join hands and circle left. Ladies in the men's section.
Virginia Bowles loves to square dance, but her heart danced to the beat of a different drummer.
Virginia had an abnormal heart rhythm called AVNRT, which stands for AV nodal reciprocating tachycardia, and this was something that she had been plagued with for many years. We had her on 2 different medications to try and control her heart rate, and still spontaneously she would be sitting at home and her heart rate would go up to 150 beats per minute. She was getting a lot of chest pain with this. She was getting shortness of breath.
I got so run down that I just felt nervous and jittery, and I just didn't even feel here half the time.
For ladies, get back home.
When Virginia's medicine stopped regulating her heartbeat, it looked like her dancing days were done. Square dancing is demanding. 2.5 hours on the floor equals 3.5 miles of exercise. But Dr. Hammock kept Virginia on her feet as she became his first electrophysiology or EP patient at the Blessing Heart Vascular Center. EP is the diagnosis and treatment of heart arrhythmias or abnormal heart rhythms caused by problems with the heart's electrical system. The heartbeat is controlled by a smooth, constant flow of electricity through the heart. A short circuit anywhere along this electrical pathway can disrupt the flow of signals, causing an arrhythmia.
This one in particular is associated with just a lot of shortness of breath and just a lot of feeling very fatigued. It also causes a lot of concern in patients because they'll be sitting there eating dinner and their heart rate will take off. And 150 beats per minute is actually fairly slow for this. Frequently it's up to around 200 beats per minute, so some people pass out with that. Some of the other abnormal heart rhythms that I'll be treating are associated with stroke. Some of them are associated with developing a weak heart, and some of them are associated with sudden death.
One of the ways to fix an arrhythmia is through cardiac ablation, using catheters with electrode tips inserted into the heart to deactivate a small amount of tissue at the site causing the arrhythmia. Virginia had cardiac ablation on Monday, August 26, and was back square dancing 12 days later. She said her EP experience was painless.
It seems very scary, but it's really not. As long as you trust your doctor, there's no reason for you to be afraid of it.
Dr. Hammock with Blessing Physician Services is the first cardiologist on the Blessing Hospital medical staff to perform electrophysiology. He recently completed a year-long fellowship in cardiac electrophysiology at the University of Oklahoma Medical Center in Oklahoma City.
As the cardiology program has grown over the last several years, we have noticed an increased demand for electrophysiology services at Blessing Hospital. Seeing a substantial amount of our business leaving to Springfield and to Barnes Hospital, and these were for things that could be done right here in Quincy, I thought, well, I'm only young once, I might as well give it a shot and go do 1 extra year of training.
EP also involves the implantation of sophisticated heart pacemakers and defibrillators, services that were not available at Blessing until now. For more information on EP, talk to your healthcare provider or call Blessing Physician Services at area code 217-224-6423 and ask for the cardiology department.
Do-si-do and promenade home.